Brad Jacobson, who is the chair of the sports medicine department, Mr. Josh Long, who's the director of our athletic training education program on campus, and Mr. Tim Harvey, who is the director of our exercise science program on campus. And they are eager to share a little bit about why they enjoy working in these departments on our campus. Mr. Jacobson, do you want to go ahead and take it away?
I sure do. Thank you, Andrea, for all you do and for arranging this today. Again, we greatly appreciate you spending time with us today. Our sports medicine department, and we're talking about the whole department right now, as I mentioned before, has three unique majors. It has a sports medicine major, which houses our pre-health curriculums, pre-medicine, pre-physician assistant, pre-physical therapy, and pre-occupational therapy. We have exercise science, and we have pre-athletic training. As I mentioned before, the department has two academic facilities where we have our didactic classrooms. We have two state-of-the-art human performance labs, which you will learn hands-on how to use all the pieces of equipment in those labs in order to do your capstone research project, and also then to apply those clinical skills when you go out into the workforce. We also have a minor in exercise science, and we have what's called an academic pathway in orthopedic technician. So you can see the multiple career paths that our department offers, and we strongly encourage students to investigate these career paths that are within our department. Approximately 50% of our students in the sports medicine department will either double major or major minor, or have a major and then do the orthopedic technician pathway. But what we say to our students is that you need to groom your educational experience to who you see yourself being as a professional allied health career provider. So I kind of already did the first bullet related to the pre-physical therapy, pre-PA, pre-medicine, and pre-occupational therapy. These programs prepare you and qualify you to apply into those terminal degree programs. So if you want to become a physician, you do pre-medicine. If you want to become a physician assistant, pre-PA. If you want to become a PT, pre-PT, and then obviously occupational therapy. Our pre-PT curriculum has actually 12 guaranteed slots into terminal degree programs, 10 at Duville College in Buffalo, New York, and then also 2 at Gannon University here in Erie. But most of our students go elsewhere. Like we have 5 students right now that are cohorts within the University of Pittsburgh's doctoral physical therapy program, which is ranked #1. So you don't have to go to those spots at Duville or at Gannon, but they're there for the taking if you so wish. We have a master's degree in physician assistant studies here at Mercyhurst. Approximately 4 to 5 of our students go into that master's program here at Mercyhurst. They have what is called preference. It's not a guaranteed slot, but if you have the same qualifications as another student that is applying for that slot from another university, they will take you. We've had approximately 42 students out of our sports med department go into the master's PA program. All of them are either employed if they're at that level, you know, post graduating. They're all licensed and they've all done extremely well. So we've been very successful with that. We also have our Bachelor of Science in Pre-Athletic Training, and you'll hear more about this. It's a 3+2 or traditional curriculum. It's an expedited curriculum if you so wish. And Mr. Long will talk about this, and it qualifies the student again for entrance into a master's degree in athletic training. And I know Mr. Long is going to touch about our master's degree program there as well. And then our Bachelor of Science in Exercise Science. This is an employable degree in exercise science. This actually prepares students to go on and be a strength and conditioning coach or to be a certified personal trainer. Also prepares you to go on into master's degree or doctoral degree programs in related fields to exercise science, like exercise physiology or possibly kinesiology. I did mention also the orthopedic technician certification exam preparation. An orthopedic technician is one who works in a casting room or an orthopedic office. That is also an employable pathway. So again, you can see the diversity and the opportunities that are there within our department. And we just strongly encourage all of our students to investigate that. I always use the analogy of walking into a pastry shop and seeing all these beautiful pastries and not knowing what you want to choose. You have to taste them to find out what you would like to buy. So what I encourage all of you to do that are looking at our department is, if possible, reach out into the allied healthcare professions, all of them. Try to set up a shadowing or some type of observation with different healthcare providers so you can see where your passion lies, where you see your future heading. Okay, longest running sports medicine department in the United States. We've been here since 1985. Not trying to brag or tout about our longevity, but we're here for a reason. And we feel that reason is that we provide the students with a quality education, hands-on based education. Our motto of, with theory is all great, but knowledge without application is useless. We have to teach you hands-on skill sets, which then you apply clinically with your patients. Okay. I just don't want to read everything here. We also have, for the exercise science majors and for our sports medicine majors, they have to complete a capstone baccalaureate research project. I'll let Mr. Long talk about the research requirements for pre-athletic training. This is unique. We started this in 2002. You're actually doing a mini thesis, which sets you apart. This is your project with the faculty members' assistance to you. And this is unique because now when you're applying into graduate schools, you can say that you have actually done research, evidence-based medicine. And that's the other thing we stress in our department is evidence-based medicine. And that comes from research. So you're understanding the model of clinical practice, of why we come up with decisions of how to treat our patients. Okay, we've had our students present their research projects, both at their state, regional, and national level. One of our students presented her baccalaureate research project in conjunction that she did with one of our faculty members here at the national level. And she's currently at Baylor University completing a PhD in exercise physiology. And she was provided a scholarship for that. And so she's our first undergraduate student that actually presented her research at a national convention. And again, most of the 99.9% of the people you see present at a national convention are either practicing healthcare providers or graduate students. We also have some research in a collaborative agreement with the CDC, NIOSH, the federal government, which is extremely unique. And that has been arranged and set up through one of our great faculty members, Dr. Robert Chetland, who worked with the CDC for a couple of years. And so we have a connection, and our students will then have the opportunity to then do internships with the CDC as well. And please ask questions as I go if you have them. You can go to the next slide, please. And again, I talked about our motto, knowledge without application is useless. So almost every major, not almost, every major you have here within our department, you'll be learning a hands-on skill set. For the pre-athletic training majors and the sports medicine majors, you're going through orthopedic evaluation classes that teach you how to orthopedically evaluate the body from head to toe. You'll learn how to evaluate for sports medicine majors, the heart, the lungs, the ear, nose, throat. You'll learn how to evaluate for a concussion. These are skill sets that most undergraduate students do not take into their terminal degree programs, whether it be medical school, PT school, PA school, master's degree in athletic training. We have a 90% success rate of our students entering terminal degree programs post-graduating from our sports medicine department. This is above the national average, and we're very, very proud of that. Very elite schools, Penn State University, UNC Chapel Hill, Duke University, University of Pittsburgh. These are prestigious schools that are accepting our students because they realize the skill set and the knowledge base and how talented that they actually are. Next slide, please. I'm going to turn this over right now to Mr. Josh Long, who's our pre-athletic training education curriculum director. And I'll probably touch base with you later on as well. So Mr. Long, here you go, bud.
All righty. So thank you, Brad. Again, as Brad had alluded to earlier, the sports medicine department is one of the oldest ones in the country. The athletic training education on campus here is also one of the oldest ones in the country. So regardless of the size of the school, it's kind of a unique thing that we've had this long-standing tradition of athletic training education on campus. And we like to think that we do a pretty good job of it. And you can see that a lot of our alumni are spread all across the country in a variety of different settings that athletic trainers can work at. Now, one of the things that I would say, and I was just having this discussion with somebody yesterday, is that athletic training is kind of a misnomer. No longer is it strictly working with the traditional ball, bat, sport type of athlete, quote unquote, right? It's going to be anyone that's going to be physically active. Just had a conversation with one of our custodial staff on campus, because that person, first off, is near and dear to all of us, but also a person who really is very physically active. And we can apply a lot of the tenets that we would normally apply to perhaps a football player or a soccer player or a basketball player, and now apply those to somebody else who is being physically active, because really the body is set up in very similar ways, regardless of what the person's actually doing. So one of the things that's unique about the pre-athletic training major is that athletic training across the country is moving to the graduate level. So this is again, a nationwide kind of discipline specific movement. And so we're trying to get ahead of the game. And we will be having our masters of science and athletic training set to start presumably here this upcoming summer. But one of the things that they've seen across the country is that students are not necessarily entering into those programs all that well prepared, because they haven't had enough of an introduction to the skill set. So one of the things that the pre-athletic training major is intended to do is to provide you with all of this informational or introductory information for athletic training, such that when you were to get to the graduate level, you'd then be able to hit the ground running and you'd be ahead of the curve. So with this, again, the pre-athletic training major is intended to prepare students to go to graduate athletic training programs. That is where athletic training is going across the country. That being said, there are a few employable opportunities that you could have with a pre-athletic training major, whether it's going to be in kind of a health and wellness arena, or if you were to follow the orthopedic technician route, something that we would teach you at the undergraduate level. But again, intended to prepare students to go to the graduate level. So some of the things that we really try to emphasize that, again, kind of differentiate our program from other athletic training education across the country is that we do have this orthopedic technician route built in. All right, this is an additional certification that you can then earn that really kind of separates you from other people that would be vying for similar jobs in the future. We really emphasize manual therapy. We want to be able to utilize kind of a hands-on approach as opposed to more of a, I guess, sterile type of approach where you're just kind of looking at the use of machines or something along those lines. So we want the person to be, the clinician to be intimately involved with who they're going to be working with and what that particular client's needs are. That kind of segues down to the bottom bullet point there is we want to look at every patient as an individual, right? Again, we had talked about there's going to be a big difference between a men's basketball player and a women's basketball player. There's going to be a big difference between those basketball players and an 85-year-old grandmother of 3, right? There's going to be a big difference between somebody who likes to cycle recreationally, or they want to just be able to play tennis, or they really want to play that kind of Saturday softball league that kind of rehash the glory from previous days. So that being said, everybody's going to have their unique characteristics, and we want to make sure that we tailor things specifically to those people as opposed to just kind of giving a rote response to be able to follow. So with that, again, another area that we really are going to emphasize, one of our faculty members has degrees in performance nutrition, and that's an area that we're going to specifically emphasize as well. That's kind of an up and coming nuance to performance. And then also kind of corrective exercise as well, is if we can try to correct some of these nuanced orthopedic imbalances, we can really separate ourselves as clinicians going forward. So again, you can see that we have alumni in a variety of settings. Does not necessarily have to be your traditional sports, clinic settings, high schools, performing arts, working in the military as civilians, working in motorsports. You pretty much can figure out where somebody's being physically active, and we can address that particular desire going forward. So next slide, if you wouldn't mind. All right, so again, we want to emphasize the hands-on approach. Oftentimes students going into the graduate athletic training programs haven't had the opportunity to do hands-on types of things yet. As Brad had alluded to previously, knowledge without application is pretty much fruitless. I will be completely honest with you, I am an alumnus of the program. Brad taught me a long time ago. And to that end, one of the things that I found to be incredibly beneficial that separated myself from from other people going forward is that they just didn't have the experience. They didn't have the opportunities to do those hands-on types of things. And specifically going into graduate athletic training programs, if you don't have those hands-on, and if you don't have the application of that foundational knowledge, you really struggle. What's the point? So we're looking to really propose that students that are coming through the pre-athletic training major are going to get exposed to the hands-on, as opposed to having to do that later on and play catch up as a result. So again, we will have all of the requirements necessary to be able to go to graduate athletic training. Obviously, you would be set up to go into Mercyhurst's graduate athletic training, but regardless of where you might want to go. Students that choose to go the accelerated route or the 3+2 would be considered direct entry. That means that as long as you meet the university and our programmatic requirements coming in, and you're going to follow that route, and you continue to meet those going forward, you would have a guaranteed slot within our graduate athletic training program going forward. Again, students coming from the pre-athletic training major would then, as Brad had alluded to, have a preferred spot going forward as well. All right. So again, all that coursework is ready and set to go. We would be both your teachers at the undergraduate level and then very heavily into the graduate level as well. So this really is far more appealing to especially those that are going to be student athletes. Oftentimes, those of you that I'm sure they're in here right now, but student athletes before, it was just much more of a challenge for those individuals to be able to meet all the requirements that we would need. Now we have far more flexible curriculum such that you can easily be a student athlete and also pursue athletic training education. And those of you that have been hurt before and had to go visit your athletic trainer at high school, you'll know the value of that person, and hopefully they've acquitted themselves well. So, all right. And I think that's it for me. No, I was just kidding. I was just for the next one here. So again, there were the two different routes here. We have a traditional 4-year option. All right. Again, this is intended to be far, far more flexible, usually for students that either want to pursue other minors and or even double major. We have one student who's doing a double major and a double minor. She has a lot of credits. So to that end, student athletes, this is also very much an appeal, because once you get to the graduate level, we're unable to allow students to also participate in intercollegiate athletics. So if you wanted to play for all 4 years, you could choose the traditional route. You could play all 4 years and still be prepared to go into the graduate athletic training, which would be a 2-year program beyond that. So this exposure is the kind of thing that oftentimes people in the past, especially student athletes, may have said, well, I've always kind of wanted to do athletic training, but it just didn't seem to jive with your other requirements. Well, now we've eliminated that obstacle. And again, the accelerated option, the 3+2, is the same exact amount of coursework. It's just that it's really done over 3 years. It's just compressed. This is really built for the student who knows that they want to go into graduate athletic training and they really want to save a year of undergraduate expenses, is really what it boils down to. Again, the one thing that really should be added to this, or at least should be known, is that students coming in to this accelerated 3+2 option would have a direct entry into the graduate program, provided you continue to meet all of those requirements going forward. So same exact coursework either which way. It's just that one is going to be over 4 years. The other one is compressed over 3 years.
I don't think Mr. Harvey's with us today. Tim, are you there? So we have Dr. Robert Chetland, who's a faculty member in our sports medicine department and also within the exercise science major, that will provide some information for you for the exercise science program. Dr. Robert Chetland.
Hello, I'm Dr. Bob Chetland. Many students within our program refer to me as Dr. C, kind of a term of endearment, which I'm perfectly okay with. I'll talk to you a little bit today about the exercise science program. So exercise science is actually an integration of many sciences, physiology, anatomy, kinesiology, and therefore delves into a wide spectrum of application. So dealing with physiology, metabolism, anatomy, and the prescription of exercise, which we generally describe as the art of exercise prescription. which implies that exercise, there's a science, there's an evidence-based practice to exercise, but it is certainly not a cookie cutter approach. It is fit to the individual. Students in our program are required to engage in experiential learning. So they go out into the field. They have to acquire 500 total hours of experiential activities. And this includes 100 hours of observation, 200 internship hours, and then 200 working hours where students are actually involved in exercise training and exercise prescriptions. So students, there are many applications to the exercise science program, from vocational to recreational to athletic and to clinical as well. Advance, please. Next, please. Thank you. In our exercise science major, students are required to master exercise prescription for all populations, as mentioned, be they athletic, recreational, vocational, or clinical. In terms of application to the general population, students also are trained to apply exercise and activity prescription for the general population. And this includes improvements in functional independence, improved quality of life, satisfaction with life, general wellness, including reduction for disease and disease risk. Next, please. Okay, so we're one of 6 programs in the state of Pennsylvania. We have a professional affiliation with the National Strength and Conditioning Association, or NSCA. It is our education recognition program. The ERP acknowledges that we provide our students with the knowledge, skills, and abilities to pass one of 4 gold standard certification exams. And this includes the Certified Strength and Conditioning Specialist, or CSCS, the Certified Personal Trainer, or CPT, the Tactical Strength and Conditioning Facilitator, or TSAC-F, and students who have an interest in working with clinical populations, the Certified Special Population Specialist. The TSAC-F is geared toward the training and physical preparation for other specialized vocations, including police, military, firefighters, and first responders. So this particular aspect, I happen to be our program director for our ERP. And all of our students who have sat for one of these exams, they have all passed. We have a 100% pass rate. So, and this makes our exercise science major, for those who choose to do so, this makes it an immediately employable degree. So, for example, if one aspires to be a strength and conditioning coach, one cannot work at the NC2A Division 1 or 2 level without this certification. In addition, this also provides an avenue for students to establish, for example, their own business if they wish to do so. Students can literally, with the CSCS or CPT degree, can walk into any facility dealing with corporate, community, commercial, industrial wellness, or clinical or medical fitness. They can literally walk into any of these facilities and get a job if this is what they desire. Our exercise science program also prepares students for graduate work in exercise science, exercise physiology, kinesiology, and other disciplines. So students have that option as well. It also prepares them for those students who are interested in MD, PhD programs. Okay. And we have some noted alumni whom are very successful after graduating from our program. Next, please.
Thanks, Dr. Chetland. I really appreciate that. Same to you, Mr. Jacobson and Mr. Long. It's now my pleasure to go ahead and introduce a couple of our current students who'd like to share a little bit about their experience at Mercyhurst with you. We have Rachel, Erica, and Emily. Rachel, do you mind introducing yourself first, telling us a little bit about you and where you're from? Oh, Rachel, it doesn't look like we can hear you. Is your volume on?
Can you hear me now?
We can, thank you.
Hi, everybody. My name is Rachel Chessar. I'm currently a senior here at Mercyhurst University. I am from Hudson, Ohio. I am currently majoring in sports medicine with a concentration in pre-physician assistant, as well as a minor in exercise science. And I just gained my acceptance to the Mercyhurst University PA program here.
Awesome, Rachel, congratulations. Erica, do you mind introducing yourself?
Hey guys, I'm Erica Zucolato. I am a senior athletic training major here at Mercyhurst. My goal at the end of this is PT, so that's the beauty of our program is we're a little bit versatile and where you can go next. I'm from Northeast PA, so I'm not too far from home here, and I'm waiting on my acceptance letter still.
Excellent, thanks, Erica. And Emily, do you mind telling us a little bit about you?
Hi, I'm Emily Bauer. I'm from right here in Erie, PA, but I live on campus. I'm an exercise science major with a business administration minor, and I'm a junior.
Awesome. Thank you so much for introducing yourself as well, too. To our prospective students that have joined us today, again, this is an opportunity for you to interact with our faculty as well as our current students. So please don't be shy about sending us some questions via text message and or engaging in the chat. I'm going to go ahead and ask our students the very first question. Why did you ultimately decide Mercyhurst was the best fit for you? Erica, do you mind starting?
Yeah, so pretty much for me, what it came down to was the faculty and the staff here. I came in toward Mercyhurst 3 separate times when I was trying to make my decision. I talked with Brad, I talked with the professor that was here before Josh, I talked to some of the clinical staff downstairs, and they just really made an impression on me. And I sat in on a class the one time and I was just amazed at the level of knowledge that the kids had as juniors. And I was just like, wow, like this could be me in like 3 years. And that was just like groundbreaking thing for me, because I wasn't really seeing that at like other schools. Like they were trying to like hype up their programs and be like, we have all this cool stuff. But Mercyhurst like really hammered home on like, we're going to teach you what you need to know. Like you're going to pass your board, you're going to pass your certification exam. Like we have your back. So
Awesome. Emily, do you have anything you'd like to add? Why did you ultimately choose Mercyhurst?
I'd have to agree with Erica, and I also really like the student to faculty ratio that we have. You could become really close with your professors and they can help you with anything that you need. I never feel the need to be hesitant to ask a question or send an email or anything like that.
Thanks, Emily. And Rachel, I'm going to toss it to you. Did you have anything you'd like to add as well, too, about why you ultimately chose Mercyhurst?
Else and what they said. Can you hear me now?
We can.
I don't know why it's okay. So I agree with everybody else and what they said. However, when I came to Mercyhurst, it was a very like family oriented atmosphere, and I'm very close to my family, so it's like a home away from home for me. And then the faculty here and in the major is like absolutely awesome. Like they will work with you with everything that you need, and ultimately they want you to succeed. So
Thanks, Rachel. I appreciate that. Mr. Jacobson, I know you mentioned it's important to go ahead and kind of see all of the desserts in the pastry shop and to sample along those. Is it possible for students to come in and know that they have an interest in sports medicine, but not necessarily know their specific direction when they come in as freshmen? What advice do you have for students as they kind of seek that best fit?
Right. And again, if you can, try to do as much observation and shadowing as possible before you get here. We do want you to declare a major if you choose the sports medicine department. But the nice thing about our department is that there's a set of core classes that uniquely run through every single one of the 3 majors that we talked about. So if you come in as an exercise science major, you can end up graduating as a sports med pre-med if you change your mind, or vice versa. We just had a young lady, and her first name's Anna. She came in as an exercise science major. She is now accepted into medical school. She changed her major to sports med pre-med. She just did that at the end of her sophomore year. So you're not locked in. We also have a sophomore review board, which helps you do a little bit of soul searching related to your career path and your passions. And that helps you figure it out. So what we say to our students, hopefully by the end of your sophomore year, you got it figured out, because then we can get you out of here in the other 2 years and you're ready to move on in 4 years. So it's very versatile. You can always change, and it won't take 5 years to do it.
Thanks, Mr. Jacobson. Mr. Long, your experience is kind of unique. You were a student here, you went out, you had a professional career, and you ultimately decided to come back to Mercyhurst. Why did you feel that was the next best career move, and what do you enjoy about working at Mercyhurst?
Yes. So I was a student. I was a student athlete while I was here. So I kind of have an even more of a broad take on what it was like to go through everything. Is one of the things that really drew me here as a student is that when I stepped on campus, it was one of those things, and some of you, the students on here, could probably agree with this, is that it just felt right. And to that end, going through my 4 years of education with Brad was being one of my instructors at the point, is it was truly a family type of atmosphere. I know that Rachel hit upon that as well. And as you leave Mercyhurst, it was one of those things that kind of stuck with you going to other places. And yes, I've worked in clinics, I've worked at colleges, I've worked in high schools, I've worked in private practice, and I just never found that anywhere else. And I had always held up Mercyhurst as a place that would be kind of my utopic goal to come back to. And when Brad contacted us a couple of years ago, begging me to come back so he could come and teach back here, it was a no-brainer. I mean, we couldn't necessarily sign on fast enough, but part of it is we did look at it objectively, and Mercyhurst does have a lot to offer that a lot of other schools are not willing to meet. Really, I think part of the reason that all of us would describe that the pandemic has been so hard on us all is that we thrive on that interaction with our students. And spending how much time that we did this summer trying to get everything set up that we could do in-person classes was a big deal, because we wanted to have that kind of family atmosphere. And that's something that even during the pandemic, I know that Erica, I can specifically speak to you in this one, but those classes they're my kids. So I get mad at them and I wish I could ground them like I would my two little ones. But nonetheless, that's kind of the atmosphere that I just did not find in other places. So.
Excellent, thanks. Josh and Brad, one of the questions that just was posted in our chat is, we have somebody that wants to be a dance major. Is it possible for Sabrina to also pursue a major in the sports medicine department as well simultaneously?
Yes.
Brad, sorry,
what
go ahead.
we've done is actually developed a contract major called Pre-Allied Health Science, which can be uniquely customized to whatever career path they pursue. So if they wanted to do, and I think we have one actually right now that's going to do pre-athletic training, that she's in the dance department, but then she's actually doing this contract major that will provide her with all the prerequisites that Mr. Long would want her to have to qualify her to go into the master's athletic training program. We have done this. Most of the dancers seem to migrate towards being a physical therapist. So then that pre-allied health science contract major would have all the prerequisites in it for her to then apply into DPT programs. So it can be customized. So yes, we've been doing that for years and it works great.
And I think that's one of the things that's unique to Mercyhurst, is we have wonderful, already predetermined educational major paths. However, if for some reason they don't fit all of your educational goals, I think the fact that our faculty are really readily available to go ahead and talk with you, we want to make sure that you are getting the best out of your investment in Mercyhurst University. So although it might not be possible to double major, again, as Mr. Jacobson said, sometimes students can create their own academic degree program in the terms of a contract major. And that's something that you're not going to see on the application, but that can be done once you come to campus, once you're already enrolled, and once you're having those conversations with your faculty members as well too.
And Andrea, if I can piggyback on that real quick, is that we currently, at least from a pre-athletic training standpoint, have some dance majors that are taking some of our evaluation classes, for example, because the eye towards the future is perhaps they still want to be more as a like a dance teacher or something along those lines, but they also want to have a working knowledge of what might go wrong with their clients going forward, with their potential customers as well. So we do have some other dance majors that are also completing all of their dance requirements with an eye of then going towards like the master's in athletic training as well. So we have others that have set up that already in addition to everything.
Thanks, Josh. I appreciate that. Roman also posed a question. He's interested in being a strength and conditioning coach and wondered if it would be possible to ever job shadow at Mercyhurst. I know in light of the pandemic, some of you have limited abilities to come to campus and things like that. But prior to the pandemic, was this an opportunity that you ever entertained with prospective students?
Yeah, of course. Anytime you'd want to shadow the strength and conditioning coach here at Mercyhurst, or even come in, and I'll just say this, and I know we're not clinically involved right now, but when and if virtual visits happen and you can come in and shadow us teaching, come in and actually see us in the classroom, talk to the students, set up a visit with us. Are visits happening, Andrea, at all, or is it all virtual right now?
So right now we do have some limited in-person visit opportunities, but it's strictly done with the admissions department. So it is a private tour and then just a quick meeting with admissions so as to kind of keep everybody's health and safety and well-being in check.
Right. So, when and if that opportunity is allowed again, I would strongly recommend that. I would assume, and Josh, you could interject on this, that if someone wanted to observe some of our athletic training staff downstairs, and again, it's hard with the COVID situation right now, but they would be able to come in and shadow them. I know that's happened in the past. Is that still probably an opportunity?
That does become a little bit harder just because there are some legal ramifications with that. So we would have to make sure that we have some of that. We'd have to have some paperwork signed ahead of time. Let's put it like that. Yeah, just some HIPAA compliance and that kind of thing. But really, it would be more along the lines of we would be able to have you shadow one of our athletic training students who then would be doing their clinical responsibilities. So again, Erica could allude to this, but our athletic training students are doing clinical things. They have been all semester long. We've had still people going off-site, and we've also had people on-site. That being said, I can assure you that we've spent far more waking hours than you'd ever care to know, creating a very strong safety protocol for those clinical experiences, whether that's going to be PPE related, or if that is just in policies and guidelines, whether that's appropriate materials and what they can and cannot do. So they are still getting those experiences because candidly, life is still going on right now. People are still getting hurt and we got to fix them. So.
Andrea, I'd like to interject something too. For the students here that are with us today that are thinking of med school or PA school, I would strongly recommend now, not wait on this, of getting certified in some allied health career professions, such as a certified nurse, a paramedic, a phlebotomist. Here at Mercyhurst, our master's PA program doesn't require what is called direct patient contact hours, but it is strongly recommended. It is like icing on the cake because there are shadowing observation hours, like we require our pre-PA students to get 200 hours, but the direct patient contact is in addition to that. So if you can start investigating that now, you're killing two birds with one stone, because then you could work over the summer as a certified nurse assistant or an EMT or phlebotomist. And so you're getting paid, but then you're also getting these direct patient contact hours, which looks great on an application to any PA or med school.
Can I just note that I think Brad is hungry because he keeps using food analogies with everything. So
Food always makes everything better.
It does.
I know we are quickly approaching the end of today's visit, and I do want to be cognizant of everybody's time, even though we are operating in this virtual world. The last two questions I'm going to pose to both our faculty as well as our current students is, what advice do you have for prospective students as they navigate their college search? And why ultimately do you feel that Mercyhurst has been a great place for you to live and learn? Rachel, you unmuted yourself, so I'm going to go ahead and put you on the spot first. Do you mind starting with those two questions?
Yeah. So Can you repeat that really quick?
Sure.
My Wi-Fi cut out.
No, that's okay. No problem at all. What advice do you have for students as they embark on their college search? And why have you ultimately enjoyed living and learning at Mercyhurst?
So I'll start with I enjoyed living and learning at Mercyhurst just because of, again, that family atmosphere. The faculty here at Mercyhurst truly wants you to succeed, and they'll help you to do so in any way that they can. I know Mr. J has been there for me every step of the way, and he's been very useful. In terms of, what was the second question again?
What piece of advice you have for students?
Definitely start early on your hours. I know that with the unprecedented circumstances that we're in now, I had trouble finding hours in order to apply to PA school because of COVID. So definitely start early. Definitely make yourself very adverse when you apply to PA school. Start early on your capstone research project. Be proud of your capstone research project because it's going to set you apart. Yeah, that's pretty much
Awesome.
that.
Thanks, Rachel. Erica, do you mind talking about what you've enjoyed most about living and learning at Mercyhurst and your piece of advice for prospective students?
Yeah, so same as Rachel, it's really a family community around here. Like our athletic training major, there's 11 people in my like senior class. Like we're a really tight-knit group. You know who everyone is. You know that if you need help, it doesn't matter who you ask. You can ask an upperclassman. You can even ask some of the underclassmen. Like if it's something you just learned, like we have a lot of fun interacting with each other. Like me helping you helps me study for my BOC. Like it's a lot of give and take and all around, and like even the professors are willing to help you with just about anything. Like it doesn't even necessarily have to be school related. Like I've been in Josh's office before and just sat down and been like, I don't know what I'm doing with my life right now. And like they just help you talk through it, like, and makes you feel better because like they're real with you. Like will reply back and he'll be like, yeah, like COVID's kind of messing with everyone right now. Like, don't forget you're not alone. Like, everything's going to be fine. It'll work out. Like, we'll get you where you need to be. So it's just that family atmosphere that you can go to anyone and get help and just vent sometimes is all you need. And
Excellent.
then advice would be don't compromise on your education. You know, I know a big thing for me was when I was trying to pick a school was Mercyhurst doesn't have a track team. I almost chose a different school because of that. I think that would have been one of the biggest mistakes that I would have made in my education was compromising to play a sport. You know, you have to fight for what you want to do. And if that means taking more classes or, you know, picking this school over a different one, like that's what you have to do. You don't want to compromise when it comes to your education. You kind of have to fight for yourself.
Thanks, Erica. I appreciate that. And Emily, what advice do you have for students and what have you enjoyed most about living and learning at Mercyhurst?
I'd have to agree with Rachel and Erica so far on what they've said, but for me, I would say the support that's offered here at Mercyhurst is unmatched by any other university. The professors are always there for you, whether you need help with school or just life in general. They're always there to listen to you vent. And then my advice would be to not procrastinate on hours, get those done early, and just stay on top of your schoolwork.
Thanks, Emily. Mr. Jacobson, you're probably one of our most tenured faculty at Mercyhurst. Why have you stayed at Mercyhurst as long as you have? What do you enjoy about it? And what piece of advice do you have for prospective students?
Reason I'm here is because of the students. You know, we tell our students, you're the department, and we mean that. You are the department. You're the heart and soul. You know, we're the faculty. We guide you, we help you, we supervise you, we give you a kick in the butt when you need it, we give you a hug when you need it. But it's on a day-to-day basis, coming in and having that interaction with the students. And the satisfaction of seeing the students be successful. There's nothing to me greater in the world from a professional standpoint of seeing that happen. You know, feeling that we've contributed to your life and then contributed to society as a whole, because you're going to go out and do great things. You will do so much good for so many people. And that is so satisfying, at least for me personally. And again, as far as suggesting to the students, and I know it's a COVID situation, but go and visit schools if you can. You will know whether Mercyhurst is right for you or any other school. As Mr. Long said, you'll feel it. It's like, man, this is right. And so I'm encouraging, if possible, for you to come and visit with us and give us an opportunity to see what we're about, because I think you'll walk away being hopefully very impressed.
Thanks, Mr. Jacobson. And Josh, you become the closer. What piece of advice do you have for students, and why do you enjoy being at Mercyhurst?
So I know you just wanted me to bring this home, Andrea. So, honestly, what you have to remember too is that Brad was my mentor, still is my mentor to this day. So if I sound like a broken record, he stole all my answers. So, but there is something unique about students, and specifically, we can speak about the sports medicine department. We get a higher caliber of students. I mean, our students are strong students. I can assure you, I have been other places where the students aren't quite so strong. We'll just say it nicely like that. But even more than the students, it's kind of the entire atmosphere on campus. I think that we can all, those of us that are already involved with Mercyhurst, is that when you have that first nice spring day on Mercyhurst campus, like there is an energy that you just don't feel other places. It gets you kind of pumped up about life. And I mean, the same kind of thing in the fall. Like they never had Hearst Day back when I was a student, and I still lament that to this day. It is probably like the single coolest day in the history of mankind. But the energy that comes about on campus when everything's just flowing is just completely unmatched. But in regards to your college search, I was just telling this to a student the other day and reiterating what Brad said. Go visit other schools. You're going to know. I think that we all feel pretty confident that we know what we do and we do it really darn well. So to that end, go visit X, Y, and Z other university. And if you feel that there, great, that's where you should be. But again, when you come back on the Mercyhurst campus, we know that, this is a very special place. And again, if this is the place for you, you're going to know right away. And so we want to do whatever we can to kind of help show you that, right? Peel back some layers or whatnot.
Thanks, Josh. I appreciate that. Brad, I appreciate you and Bob participating too. To our current students here, thanks for sharing a little bit of insight into what it's like to be a current student at Mercyhurst University. To our prospective students today, again, we recognize that this definitely is not the perfect substitute for hosting all of you on our campus. We do wish that we could go ahead and see you and show you our labs, because again, the equipment on our campus is here for you, our students. It's not here for our graduate students. It's not here for our faculty. It's definitely here for our prospective students to learn and use regularly. So again, if you find out that Mercyhurst University continues to stay on the top of your college search, we do hope that in the spring we have an opportunity to entertain you on our campus. But if we can't, please go ahead and stay tuned to our virtual events. We are going to continue to engage with you in this setting until we can physically host you on our campus. In addition, if you ever wanted to speak with any of our faculty in a virtual setting, I know that they would be happy to go ahead and schedule a one-on-one session with you. And there may even be opportunities to go ahead and allow you to observe a class virtually, because again, we are operating at times in a hybrid model. So we recognize that no two college searches are exactly the same. We also know that no two college experiences are the same, but we hope that every student that comes to Mercyhurst has the ability to reach their full potential socially and academically. There is a lot to offer and a lot to get involved in on our campus. So we want to go ahead and first and foremost, thank you for attending today's session with you. We hope that we shared a little bit of information that maybe you didn't know prior to today's session. If you do have any further questions and you'd like to continue to engage with our faculty member and current students that have joined us, please go ahead and check out some of their contact information in the chat and or reach out to the admissions department. One of the best things about working in the admissions department at Mercyhurst University is getting to know prospective students and their families on an individual basis. So please don't ever hesitate to reach out to us. I look forward to engaging with all of you again soon. Enjoy the beautiful weather. I hope your weather is as gorgeous as it is here in Erie, Pennsylvania today. And until I have a chance to see you again, either in a virtual setting and or on campus, I wish everybody continued good health. Enjoy the rest of your Wednesday and carpe diem.